Hi, Kathleen. How are you?
I'm good. How are you?
I am good. So it's so good to see you. I was just doing intros. I don't know if you saw that,
I
uh,
did.
but I just want to let everyone know that I'm super thrilled to be joined this evening by Dr. Kathleen Green. In addition to also being a Maven provider, Dr. Green is an Army-trained generalist, and she's an OBGYN who recently left academic medicine to become an OB hospitalist. Her clinical interests include health equity, sexual wellness, and providing OBGYN care to the underserved communities. Kathleen, while we're waiting for people to log in right now, can you tell us a little bit more about the work you do both on Maven and outside of Maven?
Sure. So I've been with Maven almost 7 years now, and I've really enjoyed it. And so I'm a full-time OB hospitalist in Florida right now. And so really on the front lines of COVID for pregnant women and really caring for women with COVID and women underserved population. And so really enjoying educating women about the COVID vaccine and pregnancy and taking care of women in academic medicine recently and women outside of academic medicine as well.
Awesome. Well, we have a ton of questions to go through this evening, so let's get started. Um, some of the questions we already received, and of course, if you have any questions along the way, please drop them in the chat at the bottom, and we'll make sure that we get to them. Okay, so are you ready for the first one? It's a softball.
Sure.
So the Tdap is recommended between 27 to 36 weeks. Help us understand, what is the Tdap, and is there really a best time frame to get this vaccine and then to get the COVID vaccine and other vaccines of pregnancy?
So that's a great question. So the Tdap is pertussis. So all of us should have gotten the vaccine as a child, but we know that pertussis is for whooping cough. And so it's that really kind of barking cough that I'm sure we've seen some people have. And so we get vaccinated during pregnancy because our immunity wanes, but it's really to protect our baby. So the antibodies pass through the placenta to our baby. So we get vaccinated during the third trimester so those antibodies have time to form before delivery. And we recommend that anyone that's going to be around baby also get vaccinated. So spouses, partners, grandparents, anyone that's going to be around baby as well. And we recommend waiting at least 14 days between the pertussis vaccine, the Tdap, and the COVID vaccine. So really anytime in the third trimester for the Tdap and anytime during pregnancy, we recommend getting the COVID vaccine.
And of course, we have to mention the flu shot, right? And so, as a reproductive endocrinologist, I'm kind of glad that I don't practice obstetrics past 10 weeks. People ask all the time, what is the right time to get the flu shot? And I said, at the moment you remember that you need it.
Absolutely.
Right? We have to remember that many people can die every year from not being vaccinated against the flu. So, there's some other questions that have floated here. I'm going to try to synthesize them together. And one of them was, what do I do if I have an elevated risk if I'm pregnant? I work from home and I'm extremely careful. I'm healthy and haven't gotten COVID yet, but they say that being pregnant puts me at risk for COVID. What are your thoughts about the COVID vaccine for me?
I think that everybody should get the COVID vaccine, but especially our pregnant patients, because we know that being pregnant predisposes you to increased risk of complications. So studies have shown that being pregnant puts you at increased risk of being in the ICU, puts you at increased risk of adverse pregnancy outcomes like preterm delivery and requiring respiratory support like being on the ventilator. And I love that you're being careful and working from home, but you're still at increased risk, especially with the Delta variant. So please, please, please get vaccinated while pregnant, while contemplating pregnancy, and even while breastfeeding as well.
So one of the questions on this list here relates directly to the schedule of vaccination. Can you highlight the differences between the different vaccines we have out there, when you should get your first shot, and if you have a specific vaccine, the second shot, and now even this third shot?
Right. So there's really three different vaccines, and all of them are considered safe in pregnancy. There's the messenger RNA vaccines, which are the Pfizer vaccine and the Moderna vaccine, and then there's the Johnson and Johnson. So the Johnson and Johnson is the one vaccine, the one shot. The Pfizer vaccine is the one that is FDA approved now. The Moderna and the Johnson and Johnson are still under emergency use authorization, and the Pfizer is the only one that is recommended to get the booster shot as of now, the emergency use authorization. So the Johnson & Johnson's one vaccine, the Moderna and the Pfizer, it's either going to be 3 weeks or 21 days or 28 days, depending on when you get the vaccines. And the Moderna, we are recommending if it's been more than, if it's been more than typically 28 days or 6 months, then you should get the booster. And so if you got the booster, if you got the two vaccines prior to pregnancy, then you should get the booster for the for the Pfizer vaccine. There's no current guidelines for the Moderna booster shot, but for the Pfizer, we are recommending getting it. And for pregnant patients or healthcare workers or anyone that's at increased risk, we do recommend getting the Pfizer booster shot.
So, another question that I see here in our list is two questions here that focus on the mode of delivery. Is there any difference between having a vaginal delivery and a C-section, and when you should get a COVID vaccine or a booster?
So that's a really great question. The only time that we recommend avoiding the COVID vaccine or booster, theoretically, if you have the option, is waiting between an elective procedure. So let's say that you have a scheduled C-section or an induction within 48 hours, and you can schedule your vaccine, let's say 7 days before. We'd recommend doing that because we know that the common side effects of getting the vaccine can be a low-grade fever or body or muscle aches. And so we would want you to try to schedule that 7 days prior to getting a scheduled C-section or a scheduled induction. That way we know whether the fever is from the procedure or from the vaccine, if you have that option. But at the end of the day, we just want you to get vaccinated.
And if you just want to kind of take a step back for everyone who's on this amazing session, can you help people understand why we think the Pfizer and the Moderna vaccines are safe in pregnancy, and why mRNA modality, which we really have never talked about before for a vaccine, why we think they're safe in pregnancy, and what's the data to support it?
Absolutely. So both of those are messenger RNA vaccines, which go into the cell in your body cells to cause your body to produce antibodies to it. Both of those messenger RNA vaccines are rapidly cleared from your body. So they don't make any changes to your own DNA at all. And that's why you have to get the two shots 21 or 28 days apart. And that's why you have to get boosters. And so if we were to check your body, let's say 6 months down the line, you would have antibodies, but that vaccine is already out of your system completely. And so that's why we know that it's safe. We also know as of to date, over 100,000 women have already received the vaccines, the Pfizer and the Moderna, and have no complications to baby or to mom. And as of date, over 1,000 infants have been delivered to women, and likely more. This is about 2 months ago, have delivered to women that have had those vaccines with no adverse outcomes at all. So we're closely monitoring both of those, but it's mostly because that messenger RNA is rapidly cleared from your body. And we know that if we check those cells, it's already gone from your system.
Now, I know that we're still collecting the data about the American experience of women who are pregnant and newly delivered and the outcomes associated with the vaccines. But as far as you know, how long should a baby be immune to COVID-19 based upon the immunity that's passed from mom to that baby?
That's a great question that I don't know the specific answer to, and maybe you do. I do know that the women that, when they've tested the infants from the placenta, the antibodies have passed, but I don't know how long that immunity has lasted. I haven't seen the most recent studies.
So, in preparation of this evening, I started doing a lit search. And I, too, cannot find any clear data that says how long these children have immunity. Most likely it's because we don't like to do blood draws on babies,
Right.
and babies don't like their blood drawn either. What we do know is that breast is still best, and so if you're going to pass antibodies to children, the best way to do it is through breast milk. Of course, with mRNA vaccines, yes, we do know there's some placental transfusion and transfer of these antibodies, but I don't think anyone really knows it yet, and I think the jury's still out. What I do know is that the question we just received also on here is, if you're saying 6 months for a booster, does that mean my baby is safe for 6 months? I think the answer is I don't think so. That's because the mom received the shot and the baby's only getting the byproduct of the shot. And so I don't think actually that would be the case where you would have a child immune for 6 months. But look, this pandemic's not over, right? You still have to maintain, wearing a mask, being safe. social distancing and vaccinating everyone who you love. Let's go down. So another question here is, how long does the Tdap and the flu shot offer you safety compared to the COVID-19 vaccine? Because it appears right now we're, for the first time, as far as I can remember, we're discussing the longevity of vaccines.
Right. So that we're recommending the Tdap vaccine. We used to think that it was good for 10 years because that's when we would get the tetanus shot. Now we're knowing that for pregnant women, if you haven't had one within 5 years, we're recommending getting it while pregnant or in each subsequent pregnancy. So if you got it a year ago and you were pregnant and you're pregnant again, we recommend getting it every pregnancy, not to protect you, to protect baby. The flu shot, though, is a little bit different because the flu strain changes every single year. And so that's why you get a flu shot every single year. There is some data and some, leading epidemiologists that are suggesting that COVID may be the same way, that we're going to have to get a COVID shot potentially as the COVID strain changes every single year. And so it may be that we are immune to the strain that was there last year, but as that strain changes, we have to get vaccinated against the new strain. And so it's an evolving question how long the immunity lasts. Are we getting booster shots because we need to get immune to the new Delta strain? I don't think that we really know the answer to that question yet.
So what can I expect if I haven't been vaccinated yet after my first shot, second shot, and the booster? What am I going to feel?
Yeah, so most women, whether pregnant or not pregnant, so the side effects are actually pretty similar. So most patients say that with the second shot is when they typically get that most robust immune response. And I always like to say, because this is inactivated, you can't get COVID from the vaccine, and it's similar to getting the flu shot. You're going to feel some general body aches. You may feel some joint pain. You may get low-grade fever. And you're welcome to take Tylenol for the low-grade fever. And usually 24 to 48 hours is the extent of the side effects. You may get headache. I always like to tell my patients that if that fever lasts longer than 48 hours, it's not from the vaccine. So if it lasts longer than that, please check in. Or if the fever is not responsive to the Tylenol, if you're having, high fevers, 100.5, 100.4 or higher, that's staying persistent and not responsive to the Tylenol, I would recommend contacting your provider just to be evaluated to make sure that we're not missing anything. Because we have had some patients that get the COVID vaccine, but also have COVID at the same time as well. And so we want to make sure that we're not missing anything if it seems like it's more than just a low-grade fever or not responsive to Tylenol.
That was dense, but amazing. What I usually tell my patients is whenever possible, use the internet for figuring out what to eat and what to stream, not what to receive or a vaccine. Please don't try to crowdsource your own medical advice. That's why you have doctors, and we have to go through board training. But one of the things I did want to bring up was that recently I had a patient ask me, how can I find out the safety of this vaccine? And just not from what you're telling me, but where can I see what's going on? And so I point people all the time to the CDC website, and say what you want about the government of, FDA versus CDC and, yada, yada. The CDC website actually is wonderful when you look at the Vaccine Adverse Event Reporting System, or VAERS. And you can see a lot of this pregnancy-based data. And that's where you can actually see what's been going on with the American experience with vaccines, specifically with the COVID vaccine. As a follow-up question in the chat, someone just asked, how do we know that the COVID vaccine is not associated with infertility? Given that's my specialty, I'm going to hop on this one, but feel free to step in whenever you'd like. So this has been long postulated that there's some association between the COVID vaccine and infertility because many women have complained of menstrual irregularities as a result of being vaccinated or as a result of having COVID-19. What we do know is that in certain women, they do have a robust immune response. And in anyone who has a robust immune response for anything, it could be the flu, it could be getting sick with an upper respiratory infection, it could be urinary tract infection. Whenever you have a robust immune response, you could end up with a menstrual irregularity for 1 to 2 cycles. As a result of that, changes in your hormonal milieu or environment in your body, you could feel like your cycle is off, but that doesn't mean you're infertile, right? The definition of infertility for someone under the age of 35 is attempting pregnancy for a year with no resultant pregnancy. And for those over 35, it's attempting pregnancy for 6 months. So having a wonky cycle for 1 or 2 months does not mean you're infertile, nor did this vaccine make you infertile. Instead, you're just being a really good patient and you're looking at your cycle and you're tracking it and you're saying, my body is probably immune to this really terrible disease. There's also some really compelling literature out there that men who get the vaccine have little to no changes in their semen parameters. However, in men who get COVID-19, they can have profound changes in their semen parameters for anywhere from 2 to 6 months. And the reason is that it takes you at least 3 months, 72 days, in fact, to make a single sperm from the point of creation to ejaculation. So the COVID vaccine likely does not cause any infertility or subfertility, and in fact is keeping all of us safe and protected. Another question for you, if someone has a history of preeclampsia, high blood pressure, cholestasis, or all these other scary things in pregnancy, and yes, there are a lot of scary things in pregnancy, would this vaccine affect them differently? And how do you feel about them being vaccinated while pregnant?
So that's another really great question. And the vaccine should not affect them differently at all. And this is the exact patient that's at an increased risk of adverse outcomes at baseline. So increased risk of really complicated things happening and an increased risk of bad things if they were to get COVID. So we absolutely want them to get vaccinated. This is the perfect patient. I mean, every patient should get vaccinated, but this patient especially. So definitely get vaccinated to decrease the risk of complications from getting COVID.
Given that you are an obstetrician and right, you're a hospitalist, which means for everyone who's watching, that means she goes into the hospital and she delivers the babies, and then she's the best part of her job is she gets to go home and she doesn't have to go then do office hours after, right? She actually gets to go home and rest. So she's probably the one you want delivering your baby on the labor floor because she's the one who's probably slept the most in between her shifts. Can you explain what COVID-19 has done to the practice of labor and delivery and what the experience has been like on the labor floor being a laborist?
Absolutely. I can say that the last 2 years have been, because I was also a laborist in academics for the first year of COVID. It has been the most challenging, the most difficult 2 years of my life, some of the darkest days of obstetrics that we have ever seen. There have been so many women that will never see their babies and so many babies that will never see their moms. There have been so many things that we just didn't know in the beginning and still don't know. Women coming in so incredibly sick, being ventilated, having a tube down their throat, helping them breathe before we have the COVID vaccine. Families having to say goodbye to moms and babies. It's incredibly challenging. And as physicians, not knowing if we're doing the right things, having patients deliver very, very preterm, doing C-sections under very harrowing conditions, having a sick patient, and not having anywhere to transfer them to because every single hospital is completely full. And at a hospital with limited resources, when every single bed is completely full and every single patient has COVID, and every doctor and nurse is completely stretched thin, it's been incredibly challenging. And so many women have gone through some of the toughest times that they will ever go through and likely continue to go through.
And then, for the ray of sunshine out there, can you share with us now what life is like on the labor floor in a vaccinated population? And in your practice, what % of people do you think are vaccinated that you're seeing?
So I don't know what it's like to practice in a vaccinated population, unfortunately. I would probably say 5% of my patients are vaccinated. It's extremely, extremely low. And so in the height of the pandemic, every single patient on my floor had COVID. We're still getting 1 to 2 COVID patients a shift. And I would probably say in the 2 years of COVID, I've probably had 20 patients that are vaccinated. And we easily have 10 patients on our service and a 24-hour shift. So our vaccination rate in Florida is extremely, extremely low.
And do you think it's due to miseducation or lack of education about the safety and efficacy of the vaccine, or do you think it's just access?
I don't think that it's access. We offer COVID vaccines even in the postpartum unit, and I counsel all of the patients, and maybe only a handful have accepted it. It's misinformation, it's mistrust, and it's more, it won't happen to me. A lot of our healthcare workers are not vaccinated. I would probably say more than half of them aren't vaccinated because of mistrust and misinformation, and just really, I'm not going to get sick. COVID's not really that big of a deal. They don't see what we see, and even patients that have had COVID, they think that they can't get it again, or they think that it's just really not that big a deal. And even when you try to educate them, they're just not really interested in it at all, unfortunately.
It's just amazing to me because, I practice medicine in New York, where this is required, right? I mean, every healthcare facility, effective last month. So we're in a new month right now. Actually, it's actually election day in New York City. I mean, across the country, but we have a new mayor where we're talking about these vaccination programs. But I practice in the complete opposite, right? Where if you're not vaccinated right now in New York City, you're not employed in healthcare, in the delivery of healthcare. It doesn't matter if you're a doctor, nurse, or a lawyer. And so it's wild to me to even imagine this experience that you're having with a 5% vaccination rate when I'm probably experiencing a 95% vaccination rate.
Yeah, I mean, it's very shocking.
So for those people who are looking to you as a real leader and pioneer in both your geography and where you practice medicine and what we're doing right now, can you help people understand how they can make a safe plan to protect themselves and their family members? And if you could also maybe include in the last few minutes of, when would you get your flu shot? When would you get your Tdap? And when would you get your first and second dose of COVID vaccines? If you could ideally plan it, pre-pregnancy, during pregnancy, postpartum.
Yeah, I mean, so ideally, if so, we know that the COVID vaccine is safe while pregnant. But I do have patients that are hesitant, and I can absolutely understand that. So if you're contemplating pregnancy, get the COVID vaccine while you're contemplating pregnancy. That is absolutely a wonderful idea while you're trying to get pregnant. And we know that that is safe. So we are currently giving the COVID vaccine and the flu shot exactly at the same time. And so you can definitely do that even while pregnant. Some patients are concerned about their a robust immune response. So if you have to decide one or the other, depending on where you live, I would get the COVID vaccine first. Get your first shot of COVID. 2 weeks later, get your flu shot, or 1 week later, and then get your COVID shot, your second COVID shot, if, in a perfect world. What we're doing in our, if we're offering patients the COVID and the flu shot in the postpartum period, if I had to choose between one, I would definitely get the COVID shot right now, just because we're not seeing that flu epidemic or the pandemic right now. It's more COVID for us right now. And then I would get the booster, if you've already gotten both and you've already gotten the flu shot as well. And I tell patients, you want to protect you and you want to protect your baby. And so the best way to do that is to get vaccinated while you're pregnant and or breastfeeding, so that the antibodies pass to baby. And we want to make sure that you can't control anyone that's around you. There's vaccine hesitancy in our community. And so we don't know who around you is going to be vaccinated, but just based on our vaccination rate, it's going to be low. But you can protect you and you can protect your baby. You're going to be your baby's best advocate. So you getting vaccinated while pregnant is going to protect you, and it's going to pass those antibodies to baby for flu and for COVID. And so I would strongly encourage you to do the education yourself. I've been printing out the ACOG committee opinion for my patients to get the information as well. I think it's a little bit easier for them to read, and I highlight the important parts for them, and it answers all of their questions in an easy to read format, and that seems to really help them understand why we strongly recommend it.
Look, I think you said it perfectly, which is that the academic societies that we look to for advice and guidance on how to take care of our most difficult patients have really put out some of the simplest recommendations, which is, when in doubt, go get vaccinated. It also means that we can't let down our guard, right? We still have to wear masks. We still have to wash our hands. And look, it's very geographical. The conversation in New York right now is a lot about people vaccinating their children. They were fast to get vaccinated. They were even faster to get their parents vaccinated. But now the conversation is changing of when do I get my child vaccinated? And fortunately or unfortunately, schools are really leading the charge in these discussions. I say fortunately because the conversation has to happen if the school mandates it. I say unfortunately because I just don't know if the teachers are the ones who are the most well equipped to actually have these really challenging conversations. With that said, we're getting a handle on this pandemic, and I think we're really being able to protect and help our patients by helping them understand that the vaccine is safe in pregnancy, before pregnancy, and after pregnancy. It looks like actually we're running out of time. We have time for one more question. And the last question was, if I have to have a C-section for my delivery, does that 48-hour window that you mentioned mean that I can't get the shot in the hospital?
No, absolutely not. So we are, and of course it depends on your hospital. I can only speak to what we're doing, but we are absolutely giving and offering the COVID and the flu shot at the same time, whether you had a vaginal delivery or a C-section, because we're doing it right before you go home. And so theoretically, you'd be out of that risk or be worried about infection. And if we have to worried about infection versus COVID, we're going to worry about a potential, could this be COVID vaccine or infection? So we're going to give you the COVID vaccine and the flu shot if you want it, and we hope that you want it.
That's brilliant. Well, actually, it looks like we're right out of time. So thank you so much for being punctual, and thank you, Dr. Green, really for all of your great questions. Thank you, everyone who stuck it out for the last 30 minutes, and thank you for submitting your questions in advance and also for your questions through the chat. We really appreciate you joining, and we just want you all to know that Maven is here to answer all of your questions about the vaccine. If there's anything that we didn't get to tonight, you can find both of us on there, right? You want to talk about being pregnant, before pregnancy, or after pregnancy. We're both more than happy to help you with your own guidance and to help you understand what you can do to protect your family. Now through November, you can video chat or message a Maven provider for free using our code called Ask Maven. So thank you, everyone. Thank you, everyone, for participating. Thank you again, Dr. Green, and everyone, please stay safe.
Bye.
Bye.